Hi, I'm Dr. Thomas Pontinen with Midwest Anesthesia and Pain Specialist, and today I'm here to talk about your knee pain and what we can do to help you get out of it and living the life you want to live. Knee pain, I would say along with back pain, is the most common thing we see at MAPS. This could be chronic knee pain, so arthritis, as the cartilage thins as you age. It's very common, and that is kind of a slowly progressive pain that will worsen over time to becoming a constant pain that limits even walking. You can have pain at all times, even when sitting in a chair or lying in bed. And the other type of pain would be more acute pain, meaning pain that's lasted a shorter amount of time, usually due to an injury. So that could be tearing something like a ligament or a meniscus, which is the cartilage in your knee. And that's treated a bit differently from chronic wear and tear knee pain that generally happens as you get older. Most often, you'll start with some element of physical therapy, maybe some basic medication management. Imaging like x-rays or MRIs are done, depending on what we feel the condition might be. If there is tearing, like in the meniscus, and it's deemed that you don't necessarily need surgical repair and that you should try more conservative management first, there's a few different types of injections we can do to help with that. So a regular steroid injection in the joint, it's been around for many years, very common. That'll just help bring down the inflammation and help you get back to normal activities. Those generally last for a few months and then the effect will wear off. But during that time, it's possible that your knee heals and then the pain doesn't return. Another very common thing that I'm been more excited about recently is regenerative medicine. And so platelet-rich plasma injections, or PRP, is something that a lot of people hear about. It's where you take your own blood, spin it down in a special filter, and then extract out the platelets, among other things, growth factors and so forth, that help the tissue heal. So there's really good evidence to support its use in both acute and chronic injury. So if you injure a joint like your knee, you can inject this cells, and not only do they help heal the tissue, but they also recruit other healing cells from your body because they create signaling molecules that then improve your body's own healing of that tissue on a more long-term basis. So that's an ongoing process that'll go on, and not just for weeks, but for months. And then the hope, of course, is that it helps heal the tissue to a point that it doesn't need any more treatment. It just helps your body heal more quickly. And then there's something called hyaluronic acid, or like Hyligan or Suparts. There's a bunch of different names, but it's basically like your body's natural lubricant. So it's used in a variety of things that can be found in like aesthetic products, lotions and gels. People take it orally by pill for supplement. But with knees, you inject it into the knee joint, and it basically increases what's called the viscosity of the synovial fluid and makes it basically thicker in a way. And then it also stimulates your body's own natural production of it. So it is very helpful, usually more so in chronic type conditions, arthritis and the degeneration, but can also be used in various acute conditions. As far as the chronic knee pain, we'll usually use radiofrequency ablation. So 3 needles are placed on either side of the femur above the knee, and then one below the knee by the shin bone. And then we use heat to denature the protein, so it stops the transmission of the signal. So basically, like, your knee can still hurt, but it's not transmitting the signal of pain to your brain. So those can be used really for any kind of chronic knee pain condition. But it was originally developed for people who had knee replacements and still have pain, because you can't inject into the joint like hyaluronic acid or steroid won't work with a replaced knee because the surfaces are artificial. So, but you can block the pain from getting transmitted to the brain. So that can be done with either heat and radiofrequency ablation, or cold, which is called cryoneurolysis, where it's a special handheld device that lowers the temperature to basically freeze the nerve, and it has the same effect of transmitting this pain signal, but you can affect different nerves that come from the knee. So some people will get both the radiofrequency ablation and the cryoneurolysis because they affect different nerves that come from the knee, but it's the same concept where you're preventing that pain signal from coming from the knee to the brain. And that could be done even with other surgeries. So you can get that before a surgery that you know you're going to have some pain afterward with the knee to prepare for the surgery itself and help not only with the pain associated with the surgery, but also after the surgery, and it can help with recovery. Probably the last main way of treating more chronic knee pain would be something called a peripheral nerve stimulator. And that's a device that's implanted in the thigh. It's about the size of the end of your pinky. And there's two leads or flimsy wires that go off it, and they go on either side of the thigh bone above the knee. And they use an electrical current to block the pain signal from coming from the knee joint itself up to the brain. The advantage of that is it's a permanent, as long as you have the stimulator in your body, it's a permanent fix. Whereas all of those others I mentioned are more temporary. So the radiofrequency ablation or the cryoneurolysis will last maybe 6 months or so, but eventually will wear off. About a year is the most amount of time I'll see. And then you have to get it repeated. But for someone who it works well, it's done in the office. They come in. It's a 15-minute procedure with just needles. There's no cutting involved. You walk in, walk out. And to do that once or twice a year and get relief every day, all the time, is a no-brainer for the people who it works for. And with PRP, for example, or some of the other types, you're actually hoping to heal the tissue in a more permanent manner. Now, it's possible with arthritis, that's a degenerative condition, so you're going to continue to experience that. So PRP may need to be repeated, again, once a year or something like that, depending on response, but it generally works longer and more effectively than something like a steroid injection. We do a lot of knee and back braces as well, but as far as the knee, it helps with alignment. So we have rigid braces that often, if you look at a knee straight on over time, if there's more degeneration on one side, like the inside or the outside of the knee will start to bend either inward or outward when you're looking straight on. And what that does is the more that it bends, the more pressure is going to be put on the side that is decreasing in thickness. And so it cascades, and then the knee becomes either more like bow-legged kind of, or knock-kneed, you'll hear, and that just increases the pain. A knee brace can help prevent at least the worsening of it, and sometimes help correct it a little bit. And also with the pain, as it offloads the inside or the outside of the joint. In addition to providing, just from a psychological standpoint, people feel more secure, because knees that have pain, you do something called guarding, where you'll subconsciously remove either your foot or your hand, like it's like touching a hot stove or stepping on a tack. Like you remove your hand or your leg gives out before you can even process the pain consciously, because it's a reflex arc through your spinal cord. And so with bracing, will increase stability when people are walking, because they have that brace, that rigid brace that's helping maintain the alignment. It just gives them that sense. It helps them walk more easily. And then, of course, the compression component, like it feels good when you rub your thumb after you hit it with a hammer. You're stimulating non-pain fibers, which then in turn inhibit pain fibers. It's called gate theory. And so by doing that, by wearing something compressive and stimulating non-pain fibers, you can actually improve your pain levels as well. The easiest way, you can go on our website, mwpain.com, and we have multiple landing pages about knee pain. A lot of it goes through in more detail what I've been talking about here, with the various treatment methodologies and options. But the easiest way is just to come in, make an appointment. We take all major insurances, including Medicare. So there's a very high likelihood that we'd be able to at least see you and evaluate your pain in the clinic, and then we determine what's best for you. But we have 8 locations around Chicago. There's a high chance that if you live in the Chicagoland area, that one of those locations are going to be relatively close for you and convenient. There's a very high chance that if you have any kind of significant knee pain, or have had this pain, for more than just a few weeks, there's a very high chance that we have the ability to help you in a significant way, all the way from, as I mentioned earlier, if you're a young athletic person and you've only had this pain for maybe a month, versus if you're older and you've had this, which is likely, say, arthritis related, and you've had knee pain for years, but just have never bothered going in to get it looked at. There are many, many treatment options now that we have to offer that are not just pushing surgery or a knee replacement. These injections are very simple. They're well studied. They're not bad for you. There's very little side effect profiles with a lot of these injections. And really the worst case scenario is it doesn't help much, which is always possible, but very unlikely. But with the flip side is if it does work, it can provide very significant relief for you for months, if not years. That's why I went into pain medicine. It's so cool because you do these procedures that, from my perspective, can be technically challenging and they really do make a difference. I mean, I would go so far as to say that I don't really remember success stories as much as I remember the patients we can't help because it's so rare. I can think of probably 3 patients in the last 5 years that, of the thousands that I've seen, that I wasn't able to help as much because it's so uncommon and so rare that we can't help, that the norm for us is significantly changing someone's life. And that's why it's so satisfying to me. They give you hugs. They remember when your birthday is. They give you Christmas cards. You really become friends with these people. Anyone who's had chronic pain, me included, knows just how debilitating it is, how much it impacts you, not only physically, but mentally and emotionally, and how life-changing it is to have something like a procedure or a form of treatment that significantly alters that. You become a different person. It changes your identity. You're not just someone who survives every day despite being in all this pain. You're someone who can actually seek out things you love again. You don't have to let that pain define you as a human being anymore.